I'm Liz of Body Temple Online, integrating physical therapy, yoga, and fitness. I came across a really cool study in the December 2020 issue of Heart and Lung Journal. The title of it is The Effectiveness of Oropharyngeal Exercises Compared to Inspiratory Muscle Training in Obstructive Sleep Apnea, a randomized controlled trial. And what they did is they took 3 groups. It's a small sample size, but they did have 1 control group and 2 exercise groups. One group did some face and tongue and soft palate exercises, and the other group did resisted inspiratory muscle training exercises. We'll get to that second group or that last group in a minute. But the first group did a bunch of exercises, and I want to give you a sample of some of these because they may help decrease snoring. The results of the study was that the control group showed no improvement, but both the inspiratory muscle training group and the exercise group, the oropharyngeal exercise group, both improved in their sleep quality. So why not? Let's do it. Let's learn some of these exercises. From the tongue and soft palate exercise group, the oropharyngeal exercise group, the first exercise they did was they took their tongue and they pressed the tip of the tongue at the junction between the teeth and the gums, and they held it there they did it for 3 minutes, but let's do it here for about 6 seconds. So the neutral position of the spine and the head and jaw, line that up. Vertical face. Neutral jaw is the teeth open, lips closed, and the tongue on the roof of the mouth. But here we're going to curl the tongue, press the tip at the back of the teeth, close the lips lightly, and breathe. And relax. As a beginner, I would repeat that a few times, maybe 6 times, 6 seconds. You'll feel some tone building up in here in these base of the tongue muscles. The second exercise we're going to choose from the sample of the study is sliding the tip of the tongue all the way back and also holding it. They held it for 3 minutes, but we'll hold it for 6 seconds. So again, neutral jaw, lips closed, curl the tongue, slide it as far back without gagging, and hold. And relax. So I recommend as a beginner doing about 6 times, 6 seconds. So we just strengthened the base of our tongue. Let's stretch it. Another exercise they did in the study was take your flat tongue, press it on the roof of the mouth, and then open the jaw to lengthen these muscles here. Like so, and hold that while you breathe through your nose for research in physical therapy says 30 to 60 seconds for a good stretch. So some nasal breathing there. We'll hold it for about 10 seconds. Fabulous. When we're stretching, it should feel good. There should never be any pain with any exercises. All right, the third exercise they did in the study was a forced inspiration through the nose and then a forced expiration by making the ah sound. So in physical therapy, these exercises, by the way, came from speech therapy. And combining what I know about physical therapy, when we're strengthening, we need to provide some resistance. And in this case, the resistance of the inhale in the study is through the nose, and the exhale is through our pharynx, our soft palate, our vocal folds. So we'll get more into that in a minute. But this exercise was simply inhaling through the nose and saying ah, the A sound, as long as you can. Excellent. So that's a sample of the exercises from the oropharyngeal exercise group. The other group, the resisted inspiratory breathing exercises, they used a machine. I've also come across a machine, a simple device that was recommended by a physical therapist who works with pediatrics. Her name is Mary Massery, for those of you interested. She's also been working with patients who are surviving from COVID and working with inspiratory and expiratory exercises. And this little device, it provides resistance for expiration and inspiration. So this study was on inspiration with the device and expiration with the chanting, the ah sound. In yoga, if you don't have access to a device, you can use the ujjayi sound on the inhale and exhale to use the throat to provide resistance. The sound, the ah, the fogging of a mirror, and ah sound, ha sound. On the inhale, that's a little bit of resistance, and on the exhale, that's a little bit of resistance. My combining of credentials tells us that might be beneficial as well. But mimicking the study some more, you can use an inspiratory device like this. And this provides resistance instead of our throat, internal resistance. This provides external resistance to make our muscles work harder. So if you're a little more serious about helping yourself or somebody else decreasing their need for a CPAP machine, these things I just talked about can help with that. So, and they're accessible to most of us who can watch this video. Thanks for watching. Do take care and keep breathing.